You're listening to the UBC Medicine Learning Network.
Welcome. You are listening to Metamorphosis, a podcast designed to help medical students navigate their careers. My name is Ella, and on today's episode, we're talking with Dr. Jill Lynn, who is a first-year pediatrics resident at the BC Children's Hospital. Hi, thank you so much for coming on the show. Would you mind introducing yourself and telling me your preferred pronouns?
Okay, yeah, hi. This is Jill, and my preferred pronouns are they, them, or she, her.
Great, thank you so much. My name is Ella, and I go by she, her pronouns. So, just to begin, would you mind telling us a little bit about your journey into medicine?
Wow, big question. So I'll say medicine is my second career. Um, Before medicine, I was working in biotechnology. So when I graduated from my undergrad, I did have like a science background. I graduated from a degree in medical laboratory science, kind of pathology and lab sciences. When I graduated, I also had a interest in business. I went to a program called Master of Biotechnology at the University of Toronto to pursue my interest in business. It is a business program with its focus on the biotechnology industry. So it is a really cool program for me because I have a science background. Um, and that's what the program is meant for as well, is for science, is for students with science background and with an interest of wanting to go into the biotech industry and very business focused. So I went through that program and then landed on a job in biotechnology. So I worked in biotechnology for a couple of years before I applied to medicine. I think the reason why I then applied to medicine was medicine has been on the back of my mind. Um, but at that point, I think when I first graduated, I just didn't feel strongly about it. And it's not until I work for a couple years in the industry, I've kind of felt a plateau. And I also felt something's missing and just hoping for a change in the industry. So then I started applying for medicine.
I think it's so cool that you've had multiple different perspectives of the medical system being in that biotech field before you entered medicine. It must give you such a unique perspective. So I think that's really awesome. Now that you're a pediatric resident, I was wondering what the average day in your life looks like or what the residency program is like.
Because a day can look very different, depends on the rotation I'm on. So, in as a pediatric resident at UBC, a lot of our rotations in our 1 year are based in BC Children's Hospital, and within that, we rotate through, for example, some of the subspecialty blocks such as respirology, gastroenterology, of course, all in the pediatric context. And of course, there are also a lot of general pediatrics, sort of inpatient hospital blocks that we do. For example, CTU is a huge part of our first year. We have 2 blocks of CTU and then in a total of 1 block of night float, which is also covering the night shifts for CTU. We also do other rotations in the community. So we'll go to community hospitals to do a general pediatrics rotation there as well. We also do NICU in the first year. So quite a few different things that we do in the first year, and really depends on what rotation you're on, and that makes a huge difference in what your day will look like.
That's really great that you have so much variety. What rotation are you on right now?
I'm currently on a NICU rotation, and so I will be there early in the morning around 8 a.m. to pre-round on my patients, and then when staff comes in, we all round together, see all our patients together. It's quite interesting to take care of tiny little humans, very cute. My favorite part of it is being able to cuddle
Aw.
them. And yeah, you get some cuddling time with the neonates. At Children's Hospital, we have a unit that takes care of infants with neonatal abstinence syndrome.
Mm.
These are the babies who are exposed to substances in utero and experience withdrawal when they are born. Uh,
Okay.
we have a really good unit called the FIR unit to create a really harm reduction approach to the families there. I was just post call, so I was on a 24-hour call. So later, after I finish rounding, I go to deliveries, whether it's C sections or some instrument assisted vaginal delivery. Pediatrics will be called to be there to assist with, um, just in case if the baby needs resuscitation. And they do happen, and the pediatrics team will then be in charge of the resuscitation of the neonate. That's basically what my last 24-hour look like.
That's a really busy day. Thanks so much for
Yeah.
talking to me after after such a hectic day.
Oh yeah, no problem. And then of course I sleep after that.
Right. So with all the different rotations that you've done so far in first year, what's been your favorite?
What's been my favorite? I really like my community rotations. Kind of getting out of, because BC Children's Hospital is the tertiary center. It is the only children's hospital in BC. So a lot of the cases we see in the hospital are quite complex and quite different from what you will see in a community hospital. So I really appreciate the time outside of children's hospital to go into the community. Part of it is also my interest. I am interested in general pediatrics. So I think going to the community, being kind of on your own, um, there's no like respirologist on site, there's no like cardiologist on site for you to call easily. You can still call BC Children's Hospital, but in the meantime you're kind of dealing with the patients on your own. So I really like that. You also get some clinic time when you're on community rotations to be able to do some outpatient work as well. So that I really enjoy. And then I think the second thing I'll enjoy is why I'm on right now, NICU. I really enjoy the tiny little babies. They make me happy.
Yeah, that's so great that you found things that you're already interested in within first year. Was pediatrics always on your mind, or was that something that you discovered later on in medical school?
Yeah, thank you for asking that. I'll say I always know that I like children. I like working with children. I always like that. Coming to medical school, of course, with that interest, I thought I would be interested in pediatrics. Like early on in my first year, I thought that would be my interest. But then as I go through the pre-clerkship curriculum and going through the pediatrics content, I was like, this is not my interest. I think, studying for it is different from doing it. So then I kind of gave up that idea. I was like, no, I don't like pediatrics. I don't like what I'm learning. And then I switched kind of my interest towards family medicine, internal medicine. Thought that I really like the medical part of things, and I like the um, kind of holistic approach to patient care in family medicine as well. So I thought those are my interests. And then it's not until my clerkship year where I went through my pediatrics blog, I really find myself enjoying it very much. Like I felt the most like myself when I was on pediatrics rotations, and really enjoy the people I work with, really enjoy the children and the babies, and that's not a surprise. So then that's in third year, that's when I really kind of be like, okay, I think I like pediatrics. That's for sure. I like what I see, what I'm doing during clerkship.
Oh, that's so cool. I think that's really great to hear because as somebody who's in second year right now, I'm going through like the content and really learning about the topics, but not seeing the clinical like correlation or seeing patients, it is hard to know what I'm interested in because reading it in a textbook is very different than seeing it in real life. So it's nice to see that does shift later on.
Oh yeah,
Um,
absolutely, absolutely.
do you have any advice for when you're in either like pre-clerkship years or clerkship years about how to really like figure out if you're enjoying a rotation because of the people or the topic, or do you have any tips kind of in that sense?
I felt that shadowing
Hmm.
opportunities are nice to do. Just like I said, studying the content is different
Right.
from doing it. Um, to pick a specialty that you like, I always see it. There are like two parts of it: is the content, like what you're learning, the knowledge, um, what you're studying for, all the knowledge part. Um, and then the other part of it is what you're actually doing, who you're
Right.
interacting with, what your patients look like, what's the day to day like, what kind of job are you actually doing. So to pick a specialty, you can't base it on just either of them. You kind of have to think about, okay, this is what I'm learning, this is what I'm doing. Do I like both of them? If I don't like this part, am I okay to tolerate this part? Like it's so hard
Right.
in pre-clerkship years to find that interest without any clinical exposure. So I think shadowing in pre-clerkship years uh, will be very useful to get yourself kind of immersed in that environment. Just a little bit, better than nothing. Um, but I'll say, like, even if you don't do any shadowing and just kind of experience it in clerkship year, will probably still be okay. Because I didn't do too much shadowing myself. I did do well, like one shadowing shift in pediatrics, but that's it, and didn't find it like well. I didn't fall in love with it right away, but I think clerkship years will really help with that. So I always say no rush. Don't worry about it. Just go with the ride and enjoy.
No, that's really great to hear. So in the transition from medicine or medical school to residency, was there anything that surprised you? I know you mentioned that you didn't move locations, but still a big transition.
Oh, it is a big transition. I think in medicine, the learning curve is very steep. So you'll
Mm,
notice when you go from a pre-clerkship medical student to a medical clerk when you go into third year. That's a huge transition. And the learning curve is very steep. And then it doesn't stop there. It just keeps on going on until your residency year. So I'll say going from medical school now becoming a resident is the same. Uh, it is kind of scary at first because now
mhm.
you can sign orders without co-signature. Like your name is on it.
Yeah.
You are managing the ward. You're answering calls in the middle of the night. You do have support. I mean, there's always the senior resident or your
Mhm.
staff if you don't have a senior resident on with you. Um, but you are the first person that they call, you're first to call, so you are the first line. You'll be surprised uh, how much you improve and how much you just learn. And it's a very quick steep learning curve that you just cruise on. It's really cool to see how much improvement you can make in such a short amount of time without even realizing it. And then when you look back, you're just like, oh my God. Like sometimes I have like medical students on with me on during during different rotations, and I'll always be like, yeah, I
Mhm.
used to be like you. And I actually actually learned stuff in the last 2 years that I can share with you and teach you about. And
Right.
that is a weird feeling because time just passes by and you just
Yeah.
all of a sudden know stuff. So that's really cool. The other part that is kind of being told about, I kind of know about it,
Mm-hmm.
uh, but never realize how what it means or what it entails until I actually experience it, is how exhausting residency can be. So residency is busy. Uh, I mean, different programs, different specialties may have different levels of demand.
Mm-hmm.
But for the most part, residency can be busy. And for me, uh, what I'm trying to learn is how I keep that balance between my own well being,
Mm-hmm.
my physical well being, and also my work. So that's something I'm still trying to figure out as well. And that's being talked about in residency a lot too, is resident wellness, because we're on call so
Right.
much, we're working so much, and there's a lot of you're also at the same time a learner still. um, so there's different levels of stress. But I think luckily for me, I really enjoy what I'm doing. So mentally, I feel pretty good about residency. Physically, though, it is, I will be
Right.
honest to say, it is quite a demand.
Well, thank you so much for sharing that with me. I think that's something that's really good to know and think about when we're kind of preparing for future steps.
Hmm.
But it's nice to hear the part about you feel like you've learned so much without even noticing. So that's
Hmm.
so I know we've talked about some of the good things about being a PEDS resident, but maybe we could pivot now and talk about some of the challenges.
I guess in pediatrics, patients can be very complicated. I'm totally on with the approach of in pediatrics where we are very family centered.
Right.
And when we see a pediatric patient, when we see a child, we don't just think about the medicine. We also think about the social context. We also think
Mm-hmm.
about the stressors on the family. So the mental demand when you are dealing with a complicated case can be can be quite high, because the patients are complicated, and not only medically complicated, they can also be psychosocially complicated.
Right.
Luckily, I think in pediatric care, because of the complexity, there are a lot of supports that are in place to support good pediatric care. I guess that's, what I like about pediatrics as well. But I
Right.
think the mental demand is there sometimes with very complex patients. And for me personally, I think with some of the patients who experience really traumatic events,
Mm.
um, either it's a serious illness, or something else. For me, I do find myself getting attached to my patients,
Right. Right.
and sometimes you do feel the emotions for your patients when they are going through a very difficult time, and you're dealing with
Well,
vulnerable
it sounds like you're a
children.
very empathic doctor, so I'm sure all your patients really appreciate the emotion that you kind of put into your work as well. When you deal with those cases that do have kind of an emotional impact on you, do you have any suggestions for like if a medical student was to experience a similar thing, like where to go with those feelings?
Yeah, very good question. I think it's quite personal. Everyone is a
Hmm.
little bit different. Um, for me, for example, I have experienced like a cold blue, and then went
Right.
and tried to resuscitate the patient, and eventually the patient passed away. Very big event. And when that happened, my resident cohort, when they heard about it, I cannot count the number of people who texted me, tried to reach out to
Oh,
me, and be like, "Hey, how are you doing? I heard this happened. Just let me know if you need any support. I'm happy to talk and just debrief." Usually, when
wow.
things like that happen, um, it depends on the culture. So in at
Hmm.
BC Children's, we there's always like a debrief session after like a difficult resuscitation um, where there's an unfavorable outcome for the patient. Um, Usually, there will be a debrief session among the healthcare providers. Um, for me personally, I kind of just sit on it. I just, take a day off and sit with my emotions and do things to take care of myself. I do sometimes approach people to talk about it and just be just to walk through what happened.
Thank you so much for sharing that. I think it's really important for medical students and honestly anyone involved in healthcare to really hear how other people are handling these emotions. So I really appreciate that
Mhm.
and you taking the time to share.
No problem.
My other questions feel relatively light in comparison, but the next thing I wanted to chat with you is about some of your experiences at UBC Medical School that maybe prepared you for your life as a pediatrics resident. I wanted to know what you did for your Flex project.
I did a project in global health. I in my first year medical school, I went to Bhutan to start a global health initiative in Bhutan. So UBC has this global health initiative that is mostly student led with faculty support, of course. And I really like the country Bhutan. Uh, so I approached my mentor in global health, Dr. Vidish Kapoor. She's like the person who's running GHI at UBC.
Cool.
Really thankful for her. And also Dr. Gilbert Lam, who's a pediatrician, um, who later also joined us in kind of running this project. So with
Right.
their support, I we started this collaboration between UBC GHI and the sort of the only health science university in Bhutan. Right now, I've already graduated, but there are medical students, UBC medical students, who are taking charge of this project right now as we speak. Um,
Oh, cool.
we got a really good team. There are people in your year who are in our project. Um, right now, we're looking into sort of the youth the youth perspectives on mental health in
Mm,
Bhutan, taking into account of their uh, culture. What does mental health mean to them? So we're doing a qualitative study uh, to survey that, to gather that information. And how we started this project was actually the topic was proposed by the our partner
mm.
in Bhutan. And they're really interested in looking to mental health in Bhutan because I don't know how much you know about Bhutan, but Bhutan
Yeah.
is known as one of the happiest countries in the world, although they are lower resource.
Mhm.
But the happiness level among their citizens are very high, and they're known for that. And they are kind of advertised that way.
Oh, cool.
But when we actually spoke with those our partner in Bhutan, they are saying that the suicide rates among young people are rising in the last couple years, and that's why they want to look into that. And that also shows you how much they value mental health in their people. So it's a very
Right.
interesting project, and that's the Flex project I did in when I was a medical student.
Wow, that's an incredible project. And it's
Yeah.
really cool to see that it's like kind of continuing on past your Flex blocks and into the future. Um, were you able to go to Bhutan at all during your project?
Yeah, I went to Bhutan in my first year, before COVID,
Right.
to establish that partnership with our partner.
With global health, was that something that you always were interested in as well, in terms of like creating these initiatives?
Yeah, yeah, I do have an interest in global health, and I think that's part of the reason why I'm also in UBC Pediatrics, because UBC Pediatrics has a global health uh, opportunity that you can pursue if you like. There are a couple residents in our program in their senior years uh, would go on like a global health where they would. I think this year we have a couple people who went to South Africa for, and it's part of their clinical
Wow.
college requirement. Uh, because they need to do clinical work that satisfy their college requirement, and it comes towards that. So we got residents there, and actually we also have like a global health kind of component incorporated to our journal club and our academic half days. Actually, tomorrow I'll be doing a presentation for our resident academic half day on global health. Uh,
Oh, cool.
so, so yeah, so that's why I do have an interest in global health.
I think it's so great that you have that connection to global health. I feel like it'll really help no matter what specialty or subspecialty you end up in. Just as we wrap up here, is there any advice you'd like to leave for our audience?
I think from my experience, m- medical students, we are very proactive about things, and that's how we landed where we are. But I think over time I have learned to actually sit back a little bit in medicine, meaning that if you're feeling like quite confused about what specialty you want to pick, um, I I I want to say, like, take your time. There's no rush. Um, in third year, that's a great time to explore, and even in fourth year, I actually uh, only finalize my decision that I'm gonna rank pediatrics first in my fourth year, not in my third year. So for like third year is kind of like, pick your top two or three specialties that you like and explore a bit more about them. And then in fourth year, as you go more in depth into each specialty, uh, kind of figuring out who you are as a person, what you're good at, and what you can contribute to the specialty. Uh, I think medicine is a definitely, like, being in medicine is a journey. It's not just a journey about helping others. It is also a journey about learning who we are as a person. And and I think that's sometimes forgotten about, is the importance of who you are in medicine, uh, not who you're taking care of.
Thank you so much for sharing that wisdom with us and for talking with us today. We really appreciate your time. And I guess we'll keep our eyes out for you at
For
Children's.
sure, yeah, yeah, yeah. Come find me. I'll be around.
This has been a presentation of the UBC Medicine Learning Network.